So in our previous recordings, we took a look at how to get started with medical cannabis on our journey, focusing on how to get a card and the doctor visit. We also took a look at how to navigate using medical marijuana as a patient, where we focused on using terminology for as you were a beginner, going to visit your doctor, and also going to the dispensary and using it on your medical cannabis journey. Now, what we'd like to do in this particular video is talk about the methods of consumption. In other words, how to use medical cannabis. This is referred to as routes of administration. We're talking about product types, onset, duration, terpene content, and also those usage tips. So when you talk about how to use medical cannabis, there really are 4 different ways of using it: oral, sublingual, inhalation, and topical. Now, each of these categories have different characteristics, and I want to focus on a couple of characteristics right now, and that has to do with the onset time and duration time. Very specifically, if you take a look at oral products, which are capsules and edibles, they'll take anywhere between 30 minutes to 2 hours to work, but they work for 4 to 10 hours. Now, this is where you need to be very careful, because a lot of people who look at edibles, whether they're gummies, brownies, cookies, whatever, you really have to wait that 2 hours. Don't eat these things like Skittles. I know some people try the cannabis product, the gummy, doesn't work after 15 minutes. They try another one. And really what you want to do is let that take effect, because they will work. And you're going to find that when they do work, they work between 4 to 10 hours, which is great if, for example, you want to be able to take a cannabis product to help you sleep through the night. So pay attention to orals. Pay attention to the fact you have to be very patient with them, but they work really well. And in fact, in many cases, orals taste very, very well, taste very good, so you're tempted to try more of them. Now, sublingual is the way a lot of people start. Very specifically, they have tincture drops that are in eyedroppers that they put underneath their tongue. You can start with a quarter, a half, or a whole eyedropper, and you can dose up and dose down. We'll talk a little bit about that. But the real key to sublinguals is they take between 15 minutes to 30 minutes to work, and they work between 4 to 6 hours. A very effective way to use cannabis, and in fact, it comes in both tincture and also spray form. Inhalation covers a number of different areas. Very famous way of using it is called flower. Flower is where you actually roll it into a joint or a blunt. We'll talk about that. There's also inhalers. There's vape pens, and there's also concentrates. And these work immediately, and they work actually between 2 to 6 hours. So you get almost immediate relief, which is why a lot of people use it, this route of administration, to address their particular condition. Another very effective way to use medical cannabis is topicals. They come in a couple of different flavors. That is transdermal patches, which actually get right into this, goes right into your skin. There's gels, there's lotions, creams, and also suppositories. Again, they work almost immediately, and based on the type of patch that you're using or the topical that you're using, they'll work between 2 to 72 hours. Now, when we talk about orals, what we're talking about are capsules and edibles. We talk about sublinguals, we're talking about tinctures and sprays. When we're talking about inhalation, we're talking about flower, vape pens, and concentrates. And when we're talking about topicals, we're talking about transdermals, as well as topical gels, lotions, creams, and balms. Let's dig down into each of these and spend a little more time looking at these. But before we do that, I want to point out that every medical marijuana dispensary here in Florida has what they call a certificate of analysis for each of their products. And this is an example of a vape cartridge that has a COA from Air. And you'll notice that in this particular COA, it talks about the terpenes, the terpene contents. It talks about the potency, tells you obviously the type of product that it is, and the route of administration. This is very, very effective because, as you'll talk about later, if you can match the terpene profile of your product to your particular condition, you get the maximum relief from medical. And how do you find out if the terpenes or the products that you have the terpene profile in it? This is where you find it, in the certificate of analysis. Now, let's talk about sublingual drops, because this is the way a lot of people start. Very specifically, this is a method of using an eyedropper to put cannabis underneath your tongue. And what it does is that when you do that, what you do is you swish it around your mouth and you get this absorbed into your mouth and it goes right into your bloodstream. Again, this takes between 15 to 40 minutes to work, works between 4 to 6 hours. And a lot of patients find this is probably the easiest way to use medical cannabis. And also when you're looking at dosing, finding your therapeutic dosing level, this is a very good way of experimenting of how much cannabis you take. Pay attention to the fact that this may take as many as 30 minutes to 40 minutes to work. So give it time to work and it'll definitely help you quite a bit. When you're using sublingual drops, you're going to see something called ratios. And those ratios, you'll hear about 1-to-1 products, for example, or you'll hear about 1-to-9 products, or 9-to-1 products, 20-to-1, 12-to-1. What does that really mean? Well, very specifically, the first number is the amount of CBD in the product, and the second number is the amount of THC in the product. And in many cases, once you find out what your therapeutic dosage level is, by increasing the amount of CBD that you're using with the product, it helps you with your inflammation and a number of other conditions that are within your body. So a lot of people use ratioed products. They'll be using them, let's say, a 4-to-1 ratio, 20-to-1, or again, in certain cases, a 1-to-4 ratio if you're trying to address things like pain. So that's where the ratios come into play. And they're very, very effective as you home in and tone in to having cannabis be very effective for you. Now, sprays are very, very important. And they actually have metered dose inhalers in the cannabis world. And we're very familiar with inhalers in the pharma world where it's being used for helping your lungs. Well, the same applies to cannabis. They're applied either nasally or in your mouth, very discreet. People use this as a way of carrying their products around and using it during the day. But you've got to be very careful because they work, again, between 15 to 20 minutes, but they'll work between 4 to 6 hours. So go low and go slow, because it's a very effective way of using it, but you do get a rapid onset. So the tip is microdose this. In other words, use small amounts of it as you go along, especially when you first start, but you're going to find it to be very, very effective. Let's talk about capsules. Just like pharma drugs, we have capsules in the cannabis business, and it actually gets absorbed through your digestive system. The nice part about capsules is that because they're being absorbed, the delta-9 is being absorbed into your stomach, it'll actually get converted to what they call 11-hydroxy-THC, which is a very, very effective way, or a very potent medical product in the cannabis world. Now, in this particular case, it could take up to 2 hours to work, usually about 90 minutes, but it'll work between 4 to 10 hours. Be very careful. Give them time to work. Don't eat these things like Skittles. Take your time. Capsules will work, but give yourself also buffers. In other words, know when you want it to start, know when you want the onset to take effect, you know how long it's there, and you'll find it'll work very, very well. The another way of looking at how to use to use cannabis in an edible world, paying attention to the dosage and be patient with them. Edibles very specifically, again, as we mentioned, could take 15 minutes to 2 hours to work. But what you really want to do is you really want to pay attention to the fact they are going to take effect. And in many cases, because they taste so well, both the gummies, the chocolates, the hard candies, what people want to do is they want to eat more of them. Well, be very, very careful. And that also goes for infused drinks and beverages, which are becoming very popular today. Be very careful about how you use these. I really recommend using them. Don't overdose in this particular area, because you will find yourself getting lethargic, get yourself tired, and you will find that negative headiness that you don't want necessarily with cannabis. One other question that people have is, how should I use them? Well, I recommend when you first start using edibles, cut them in half quarters, because that'll help you be able to find out not only how long it takes to work, in other words, your dosing level. In many cases, a lot of the products are built around having 5 milligrams of THC in it, and that might be too much for you. Again, and once you know your therapeutic dosing level, adjust for that. But I would start by cutting that edible in half, trying it that way, and being able to go forward. I do also want to point out that there's another way of using medical cannabis that's effective, and that's called topical. I use this quite a bit because I have herniated discs in my neck. What you're able to do is you're able to apply the topical directly to that particular area, in my particular case, my neck, and really you can apply it. It brings almost instant pain relief and work between 1 to 2 hours. There's also what they call transdermal product, and the transdermal product gets right into your bloodstream very quickly and very efficiently. Be aware that because it's getting into your bloodstream, you may get a high effect if you're using certain transdermal topical. But again, it's something that is in low doses. So again, depending on your particular tolerance to cannabis, THC, you'll either feel it or you'll not feel it. But it is a very effective way of using it. I'm very positive on using transdermals, and in fact, I use them quite a bit, especially when I travel, because it makes it easier for me to use the product, to use my cannabis product. Now, the reason I talk about transdermals is because getting into that bloodstream really helps you quite a bit. And also, when you're using my transdermal products, they typically will last between 8 to 72 hours. And this is very, very important, because if you can have a product that's going to carry you over a day or two of your cannabis regime, it makes it a lot easier to use the product, and also makes it easier for you to be able to get the relief that you're looking for. So pay attention to transdermal patches. Again, I'm a big fan of these, and I use them quite a bit. When people think about medical cannabis, they think about inhalation. And I'm going to start by talking about vape pens. Now, vape pens are devices that you can use to be able to use the product to be able to either smoke flower, concentrates, or oils that are in there. Now, what's interesting is when you're using a cartridge with a vape pen, it works almost immediately, and it will work between 1 to 3 hours. The way you use vape pens is you take a 1 to 2 second inhale, and then you blow out slowly. I also recommend that once you finish doing that, take another breath. We call that the secret breath. Take a second breath of just straight air, breathe it in and breathe it out. And what that does is that helps push a lot of that inhaled product back into your lungs, and it keeps it being able to go stable and helps your body be able to normalize using the medical cannabis product. This is something that's very, very important because cannabis products are vaporized. They're not burnt. And by using a vaporized versus a burnt product, it's a lot safer and it's a lot better for you to use that on your body. What's the other reason why you want to use vaporizers? As we mentioned earlier, terpenes are temperature sensitive. So if you're looking for a particular type of terpene to help you with your condition, like in my particular case, I'm looking for caryophyllene, I'm looking for linalool, and what I want to do is I want to burn at about 390 degrees in this particular area to be able to really trigger these particular terpenes, trigger these particular cannabinoids that help me with my particular condition, which is managing inflammation. By being able to set the temperature on the vape pen, I can actually trigger the terpenes that I want to help me with my medical condition. And this is very, very important. Let's talk about dry flower for a minute. This is where you just take the flower, you roll it with papers, you roll it into a joint, a bud, whatever you want to call it, and then you just take that flame, put it up to that blunt, and you burn it, and you smoke it. Now, here's the negative part of that. When you put that 500 degree temperature up to that blunt, what you're doing is you're burning off 50% of the cannabinoids, almost all of the terpenes, and almost all the flavonoids. So you're significantly reducing the medical efficacy of that particular joint, the negative part. Good news is it still works. You just have to use more of it to be able to get it to work and address your particular condition in many cases. What's the remedy for this? I recommend using vaporizers. They have devices called dry herb vaporizers. What you're able to do is you're able to put your flower product in it, and then you're able to set the temperature of that particular device, just like you did that vape pen, to be able to target the terpenes and the cannabinoids that you want to address your particular condition. And because you're vaporizing the product, you're not burning it, you're getting around a lot of the carcinogen issues that relate to putting carcinogens or negative things. Here's an example of some of the vaporizers that are out there, some of the more popular ones that are there. They're very, very effective, and I recommend that if you're going to look at dry flower as the way to go, please use vaporizers, not joints. Again, it's going to be more cost effective. It's also going to be much better to being able to have you tune in and focus right on the products that you need, especially the terpenes that you need to address your particular medical condition. Now, one of the other questions that comes up is people ask you is, can I eat medical cannabis? Can I eat raw cannabis? And the answer is yes. Very high in vitamin C, very high in vitamin K. And in fact, in many cases, cannabis has been eaten by, for example, by folks as a something to be able to help them heal their body, especially after surgeries or after accidents that are there. What's important about cannabis is that it works and it travels through your whole body. So it really provides the iron, the calcium that you need to really help you repair a lot of the DNA in your body. And it's a very effective and it's a very healthy way of using cannabis that's out there. People don't realize that, but it's important that when you're going to be infusing products into your products, whether you're making brownies, you're making gummies, or actually a meal itself, one of the things you may want to pay attention to is something called decarboxylation. As we showed you earlier, cannabis it reacts differently at different heat points. If you get the product over 230 degrees, 250 degrees, when your cannabis is first made or being grown in the plant, it's made in an acid form. So it's a THCA, CBDA, and CBCA. When you, in fact, get it to that 230, 250 degree temperature, it converts the THCA to CHC, CBDA to CBDA, CBD, and CBCA to CBC. And that's important because now you get the medical benefits as well as you get the actual CBD, THC, and CBD that you want in your product. Decarboxylation is actually putting the product in your oven, cooking it for about 40 minutes at 230, 250 degrees. Let it sit for about an hour, and then you can put it right into your product when you're making edibles. Key, when you make edibles, stir them effectively. Put that all around. Make sure that it's homogenized throughout the whole brownie, without gummy or whatever you're making. Because if you don't stir it correctly, what will happen is you'll get a lot of cannabis in one part of the brownie, but not in another part of the brownie. And you want to be able to spread that out quite a bit, get it homogenized that are there. Now, why do people do this? Because by making your own products like brownies, for example, you can have something that works for 10 hours and get a good night's sleep, and you can control the flavor, you control the products that are really out. Don't be afraid to try and cook with cannabis, but again, pay attention to decarboxylation. And later on in this series, we'll have a whole webinar just on cooking. Just thought we'd cue that up and let you know. Now, one of the most effective ways of using medical cannabis is concentrates. This is what they call, you probably heard of hash, shatter, crumble, wax, resins, and distillates. I'm a huge fan of cannabis concentrates because some of the concentrates, specifically the resins and the resins, are whole plants, which means all the flavonoids, all the terpenes are in the product when you use them. They're made through either a process of being able to put them in an ice bath to be able to pull off the trichomes, or they're actually pressing them, one of the two ways. Then when they also make other things like wax, batter, shatters, What they're doing is they're making a form that's a concentrated form of cannabis that you can put into a vape pen and be able to use it that way. Now, why would you use that? Two reasons. One is you can focus in on the terpene profile that you want. And the second is it's a very cost-effective way of using cannabis. People don't use concentrates right away because you have to actually load them into a vape pen. But after you use cannabis for 3-6 months and you're looking at how to cost-effectively use it, you may want to take a look at concentrates as an option. Here are some of the concentrate vape pens that you can purchase on the market. They're really not expensive. Most of these are less than $30. Some of them are clearly less than $100. But what you find is that they're very, very effective. They allow you to set the temperature of the particular product, which that allows you to focus in on the terpenes, cannabinoids, and flavonoids that you want, and being able to use them very effectively. And they're discreet. They're easy to carry around. They're easy to use. But again, this is something that's a two-step process. So in many cases, talk to someone who's experienced at this if you're looking at using these, or talk to your dispensary. They'll help you get started in being able to use concentrates effectively. I highly recommend trying it after you find your therapeutic dosing level. Now let's summarize a little bit. Routes of administration. We have onset time and we have duration time. You can mix and match these. I think it's important to point out, for example, my routine is I have herniated discs in my neck. What I want to be able to do is I want to be able to immediately get rid of the pain when I wake up in the morning. So I grab a vape pen, take a couple of hits off of a vape pen, and literally within a minute or two, the pain level that I am experiencing goes from somewhere between a 7 and 8 down to a 1. Right after that, right after I finish doing that, I take tincture drops. Tincture drops will take 15 minutes to 20 minutes, maybe 30 minutes to work. In my case, about 25 minutes. And they'll last between 4 to 6 hours, which will take me into the early afternoon of my cannabis routine. Now, in the early afternoon, I'll have to do something else. Otherwise, that pain is going to come back after an hour or two. So I'll either use another tincture drop, or I have my choice of using edibles or using a vape pen. That's my afternoon routine, depending on my routine, what I have planned, and what I've got to get done. What I do in the evenings is I'll typically take, and before I go to bed, about an hour before I go to sleep, I'll try an edible. That'll either be some chocolates, it'll either be a brownie. What it does, that helps me be able to, about an hour before I go to sleep, gets me to be relaxed, helps me fall asleep, but more importantly, it helps me stay asleep the whole night. It'll give me a good 8 hours of sleep, where if I use a tincture drop, I might be waking up at 2 or 3 in the morning. Same thing with some of the other forms of administration, like topicals or even inhalation. I'll be waking up in an hour or two, and what I want to do is I want to get that entire 8 hours of sleep that's really out there. So what I want to do now is say, let's summarize. We've covered a lot of topics. Key to using all of these routes of administration is start low and go slow. They will work. Give them time to work and have some patience. It may take a week or two to find the exact therapeutic dosing level, but once you find it, you're going to find it's just magic. It helps get rid of that medical condition, or it helps you manage that medical condition, I should say, and it's going to help you get your life back, which is really the objective of using medical cannabis, as well as the objective of these particular webinars and seminars and videos, to be able to help you get your life. Make sure the products that you're using have the terpene profile that match what your medical condition is. That way you'll get the most out of your medical cannabis, both from a cost-effective and an efficacy standpoint. And as I mentioned earlier, the entourage effect is really, really key. This is where the terpenes, the cannabinoids, and the flavonoids working together work better when they're working together than they do individually. And this is something that you'll find with cannabis. I want to thank you very much for watching this video. Hopefully it does help you get your life back and you understand more about how to use medical cannabis. For patient resources, please take a look at our YouTube channel, marijuanaware.com, where this particular video is being posted. And also this particular quarter, we're going through a whole journey on how to use medical cannabis, both the methods of using medical cannabis, as well as how to craft an individual plan for you, how it addresses different routes of administration, and how to use it. And naturally, if you want to get a card, take a look at Medical Marijuana Treatment Centers of Florida. They'll be able to help you get a medical marijuana card. Thank you very much for watching this video, and we look forward to helping you get your life back.